Hi, I'm going to do the head to toe assessment with my patient. Let's start the job. Thank you. Am I in the camera? Yeah?
Yeah.
Okay. Hi, my name is Fatima. I'm your nurse today. I'm going to do the physical assessment. Do you have any question?
No.
I'm going to touch your skin. Is that okay with you?
Yes.
Okay. Patient is alert and oriented ×3. His sitting is erect, posture is normal, appearance stage age is well grown and well nourished. I heard she speaks. Her speech is clear with normal pattern. Her skin is appropriate to ethnicity, and the temperature is normal. And now I'm going to do the vital sign for you. Now I'm going to palpate the radial pulse. Okay, radial pulse are equal, regular, strong, bilaterally. Now I'm going to check the blood pressure. Can I have one?
Yes.
Okay, your blood pressure is 120/80, which is
Thank you.
completely normal. Thank you. Now, do you have any pain?
Yes, I have pain in my head. I have headache.
Okay. When did it start?
From 1 hour ago.
Okay. Did you take anything for your pain?
Not yet.
Okay. What makes it better?
I think ibuprofen.
Okay. Could you please describe the pain? Is it like sharp, stabbing?
My pain is always sharp.
Okay. Do you know why you have the pain?
I always experience this pain because I have a stress, I think.
Okay. And where is exactly the pain?
This side.
Okay. And is it all over the time?
Not all over the time, but 3 times in the week.
Okay. Okay. Thank you. Now I'm going to examine the skin and nails. The skin and color is appropriate to ethnicity. There are no lesion, no lumps, and the nails are pinks with capillary refill in 2 seconds. Your skin turgor is intact in 2 seconds. Now I'm going to examine your head. Your head is normocephalic, it's and round, it's aligned with the spine. Your face is symmetrical, no involuntary movement, no facial drooping. Now I'm going to palpate your head. Is there any pain?
No.
Okay, no pain, no tenderness. No lumps, there is no lumps, no lesion in your head and head. Your hair texture is fine and normal to your ethnicity. There is no lice infestation.
Yes.
And everything is okay with your head and hair. No problem. Now I'm going to check the cranial nerve number 7, which is facial. Please smile. Okay, and frown. Raise your eyebrow. Puff your cheek. Okay, your cranial nerve number 7 is intact. Now I'm going to palpate temporal artery. The temporal artery are palpable and bilaterally. There are no swelling, no redness. Now I'm going to check the temporomandibular joint. Please open your mouth, close, jaw side to side, forward. Okay, temporomandibular is intact, no limitation of movement. Now I'm going to palpate your sinuses, the frontal sinuses. Okay. And your frontal sinuses and maxillary, I will check the maxillary sinuses. Your frontal sinuses and maxillary sinuses are intact. There are no tenderness, no pain.
No.
Yeah? Okay. On palpation, everything is okay. Now I'm going to move to your eyes. Your eyes are symmetrical, no involuntary movement. Your eyelashes are distributed equally. Your eyes are distributed equally also. And now I'm going to check your conjunctiva. Please look up. Look up. Okay, your conjunctiva is pink. Sclera is a little white. No abnormal color or discoloration. Now I'm going to check the extraocular muscles. Please follow my finger without moving your head, okay? Okay, her extraocular muscles are intact. She's able to follow my finger without moving her head and no restriction. Now I'm going to check your pupils. Okay, your pupils are equal and react normally to accommodation, and pupils constrict from 4 to 3. Now I'm going to check your peripheral vision. I will move my finger. Please let me know when you see my finger, okay?
See.
Say now.
Now. Now. Now. Now.
Okay, your peripheral vision is intact and patient is able to see my finger. Now I'm going to check your cornea. Okay. Your cornea is intact. She blinks. She's able to blink when I near the tissue to her eyes. Now I'm going to check your ears. Your ears are symmetrical. There are no earrings. Ears are in line and both symmetrical. I'm going to check the external meatus. Okay, your external meatus is pinkish in color, no discharge, no redness. I will check the other one. Yeah, external mucus is pinkish in color, no redness, no discharge. Now I'm going to check the tragus, pinna, mastoid. There are no pain. Okay. There are no pain, no tenderness. They are intact. Now I'm going to check your external auditory canal. I have to pull your pinna back and up. Your external auditory canal is pinkish in color, no redness, no discharge, no lump. Yes, it's pinkish in color, no redness, no discharge. Perfect. And no lodging. Now I'm going to test your hearing. I will whisper a word. You please tell me what I tell you. I will close one of your ears. Yeah. Book.
Pen.
Okay, your hearing test is good. You could see, you could hear. Now I'm going to do the other test. Please let me know when you hear the buzzing sound equally in your both ears.
Sure.
I'm sorry. Let me try again.
No.
Is it equally in your
Yes.
both ears?
Yes.
Okay. Now I will do the other test. Please let me know when you don't hear any vibration or any more buzzing sound. Just say now.
No. No. No.
Okay. So air conduction is longer than bone conduction. Now I will check your nose. Your nose is symmetrical. I will check nose turbulence. Okay. Your nose turbulence are pink and moist. Septum is in midline and no polyps, no perforation. Could you please close one of your nose strill and just sniff like this? Okay. Do with the other nose strill. Okay, good. Your nose is patterned. Now I'm going to check your smelling. Please close your eyes and one of your nose strill. I will give you something to smell. Please let me what is the smell of that.
Coffee.
Okay. And please close the other nose strill.
Cinnamon.
Okay. Yes. That's okay. Your cranial nerve number 1, which is olfactory, is intact. Now I'm going to check your mouth. Let's start with the lips. Your lips is pink, no lesion, it's moist, no crack, and just say T.
E.
No. Okay. Your gum are pink. There is no tooth decay, and there is no bleeding, no swelling. When just say one more time. Okay, when patients say ah, uvula rises up and rises up, tonsils are pink and 2 plus. Soft palate is pinkish, hard palate is a little bit white. Could you please tongue out? Okay, side to side. Tongue is pink, no cracking, no thermus, and tongue is in midline. Now I'm going to check your neck. Your neck is symmetrical. Trachea is in midline. And I'm going to check the jugular vein. There is no jugular vein distension. Can you move your neck from side to side? Okay, your neck is supple and no rigidity. Do you have any pain?
No.
Okay, I'm going to palpate your carotid pulse. Okay, the other one. Carotid pulse is strong, regular, and in both sides, and they are equal bilaterally. Now I'm going to auscultate the carotid artery for any broad sound. Please hold your breath. Hold your breath now. The other one. Okay. There are no abrupt sounds bilaterally. Now I'm going to check and palpate the lymphatic nodes. Let's start with pre-auricular. Pre-auricular, post-auricular, mandibular. Do you have any pain in these places?
No.
Sublingual pain?
No.
No. Cervical?
No.
Occipital is back of the head. Do you have any pain?
No.
Supraclavicular pain?
No.
Okay, there is no pain, no swelling, no tenderness, no enlargement in all these kind of nodes. Now I'm going to check cranial nerve number 11, spinal accessory muscles. Could you please push your head on my hand? Okay, the other one. Okay, shrug your shoulder. Good. So your spinal accessory muscles is intact. Now I'm going to check your range of motion of your neck. I'm going to ask your to bend your neck like this and that side. Okay, this one. Okay. The range of motion, the patient can move the neck to side. There is no limitation, no restriction. You can move your neck. You didn't feel any pain?
No.
No? Okay. Now I'm going to examine the lungs. I'm going to check the anterior thorax. The anterior thorax is conical in shape. I don't see any lesion. They are symmetrical. There are no accessory muscle used. It's relaxed. There are no cyanosis. There are no shortness of breath. Respiratory pattern is regular, and anterior AP diameter is 1 to 2. Now I'm going to palpate for any pain. Do you have any pain?
No.
Okay. So no pain, no tenderness on palpation. Now I'm going to do the symmetrical expansion. Just take a deep breath and take it out. One more time. Okay. The symmetrical expansion is equal, no lag when she takes a deep breath. Now I'm going to do the tactile fremitus. Wherever I put my hand, just say 99, okay? 99.
99. 99. 99. 99. 99. 99. 99. 99.
Okay, your tactile fremitus vibration is all equal through your thoracic cage and your lines. Now I'm going to do the percussion. Let's start with apices of the lines. Okay, there is resonance is abundant in all quadrants. Now I'm going to osculation. First start with bronchial area. Bronchial area. Okay, the bronchial area and sound is loud, high pitch and harsh. Now I will check the bronchovesicular area in intercostal space 1 and 2. Just take deep breath. Okay, bronchovesicular sound is moderate, equal in expiration and inhalation. Now I'm going to listen to vesicular sound of the lungs. Other one. Good. Vesicular sound is a little bit low pitch than the bronchiovesicular. The inspiration is longer than expiration. No cracker sound or wheezes and the air is equal and good in all quadrants.
Thank
you. Now I'm going to inspect your hands. Please follow me. Just close, open, open. Flexion, extension, supination, pronation, okay, abduction, adduction, internal rotation, do like this, okay, external rotation, okay, thank you, and squeeze my hands, okay, the grip is equal and strong. Now I'm going to ask you, please push my hands. Okay, and push my hands like this, and push my hand. Okay, your muscle strength is equal. Perfect. Now I will inspect the epitrochlear nodes. Do you have any pain?
No.
No pain, no tenderness?
No.
Okay, perfect, good. Now I'm going to inspect your heart. Let's start with precordium. Precordium is symmetrical. There is no lesion, no heaves or lifts, and no involuntary movements. Now I'm going to palpate the apical impulse. Apical impulse is in the 5th intercostal space, and it's the apical impulse is about 3 centimeter. Yeah, and it's in mid-clavicular line. Now I'm going to palpate for any thrills. Do you have any pain?
No.
Okay, there is no thrills on the precordium. Now I'm going to listen to your heart sound. First, I'm going to listen to aortic area, which is in the 2nd intercostal space on the external, right external border. Okay. Here is S2 is louder than S1. I will move to the 3rd intercostal space, which is air point. In air point, S1 is equal to S2. I will move to the 4th intercostal space, which we call it tricuspid area, tricuspid valve. Here is S1 is louder than S2. I will move to the mitral valve, which is in the 5th intercostal space. Here is S1 is louder than S2. Now I'm going to listen for any murmur sound. There is no murmur sound. I didn't hear S1, S3 or S4 sound. Now I'm going to inspect your abdomen. Let's be ready for checking the abdomen. Sure. Now I'm going to inspect your abdomen. Your abdomen is flat. Yes, is symmetrical, flat, and there is no color, there is no lesion, there is no scar. The hair is well distributed. Umbilicus is in midline. And now I'm going to osculate and listen for the bubble sound. I will start with the lower lower right quadrant. I start with right lower quadrant, and then right upper quadrant. The bubble sound is I hear the bubble sound, and it's normal acted. I will listen for right left upper quadrant. It's also normal acted. And then left lower quadrant is normal acted. Now I'm going to listen to any broad sound or vesicular sound. I will use the bell of my stethoscope to hear for any broad sound or vesicular sound. I will start with the aortic area. Okay. No broad sound, but I will hear the vowel sound. I will start and then I will check the right renal. No broad sound. Left renal. Right iliac. No broad sound. Left iliac. No broad sound. Right femoral area. Left femoral area, there is no broad sound. Now I will do the percussion. will check for all 4 quadrants. I will hear the tympani sound and no dullness sound. Do you have any pain?
No.
Okay, let's start. I will do the light palpation. Do you have any pain?
No.
Okay, I will do a little deep palpation to see if there is any pain.
No.
No pain?
No pain.
Okay, there is no pain, no tenderness, no lumps, no masses or any enlargement. Now I'm going to perform a rebound tenderness. We call it Blumberg test. Okay. Do you have any pain?
No.
Do you have any pain?
No.
Okay. Now I'm going to do the Murphy's Sun test. I will push my hand here. Take a deep breath, please. Okay. Again. Do you have any pain when you take a deep breath? Okay, so when he expiration and take a deep breath, she doesn't have any pain, so the Murphy's sign test is negative. Now I'm going to do and inspect the lower extremities. Let's start with the palpate the pulses. I'm going to start with popliteal pulse. Behind under the knees, behind the knees. They are strong, equal and regular. And then I will palpate the dorsalis pedis. It's here. I will do at the both at the same time. They are strong, regular, equal. And then I will palpate the posterior tibialis here. They are strong, equal, and regular. Now I'm going to do the range of motion in lower extremity. Could you please bend your knee? Okay, the other one, please. Okay, and do the flexion, your flexion, here. Okay, do you have any pain?
No.
Okay, I will bend your knee. Do you have any pain?
No.
The other one. Do you have any pain?
No.
Okay. Please push your feet in my hand. Okay. Do you have any pain?
No.
Okay. Your lower extremities is strong. Now I will ask you to sit and I will do the rest of my assessment.
Okay, thank you.
Now I'm going to do some neurological exam. This is sharp and this is dull. Okay, yes. I will ask you to close your eyes, please, and let me if it's sharp or dull.
Sharp, dull, sharp, dull, sharp, dull.
Okay, perfect. Now I'm going to ask you close your eyes and see if we can see if you feel what I'm doing or not. Close your eyes, please. Do you feel?
Yes.
Okay. Now I'm going to do the vibration test. I will vibrate this and I will put it in one of your bony part. Let me know if you feel the vibration or not. Okay?
I feel.
Okay, good. Now I'm going to do the position sense. And this is up and this is low. I will ask you to close your eyes and let me know what I'm doing, up or down. Okay, close your eyes.
Up, up, low,
down.
down,
Yes.
up, down.
Okay, your position sense is intact. Now I will put something in your palm and close your eyes and let me know what you feel. What is it? Okay, close. Okay, you can touch it.
It's cube.
It's cube, yeah. The other hand, okay,
It's coin.
it's coin. Yeah, perfect. Now open your eyes. Could you please do like me and follow me? Just tap your faster. Okay, alternating movement is intact. Perfect. Now I'm going to check your the other part. Let's start with the tricep. Do you have any pain?
No,
Bicep. Do you have any pain?
no,
Brachioradialis. Do you
No.
have any pain?
no.
Okay. I will do with patella. Okay. Yeah, just relax it. When I tap, yeah, I see your toes. Do you have any pain? No. I will do the pilies at the back of your leg. Okay. Do you have any pain?
No.
Okay. I will do the Babinski test. Do you feel?
Yes.
Okay, we notice that toes curve down. It's all normal reflex. Thank you. Now I'm going to ask you to stand up, please. Okay, I will check for varicose vein on your legs. Yeah, there is no varicose vein on her legs. Could you please walk heel to toe like this? Okay,
Yes.
heel to toe, please. Thank you, and turn back. Perfect. Thank you. She can walk heel to toe perfectly without any problem. Now, could you please walk with your toes, with your tip toes, please? Walk. Okay, thank you. She can walk with her toes without any problem. It's intact. Could you please walk with heel, your heel? Yeah. Okay, so she can walk with her heels without any problem. Now I'm going to ask you, put your hands aside, close your eyes for 20 seconds. This is a Romberg test. Okay, so the patient is able to stand without any swaying or falling, so the Romberg test is negative. Now I'm going to ask you, please bend one of your knees and try to sit down. Okay, good. So the shallow bend knee is intact. Good. Now I'm going to check the range of motion of the spine. And could you please touch the carpet? Okay, perfect. Do you have any pain?
No.
No? Could you please extend your back? No pain also? No? Okay. And do the rotation on the other side. Okay. Right, left. You don't have any pain?
No.
Okay. your it's done. Your physical assessments are normal. Okay, and thank you for
Thank
your
you.
time.
Thank you.
Thank you.